There's the conversation in public about mainstream medicine and alternative medicine. Everybody says, oh, I'm going alternative, I'm going homeopathic. But you've incorporated both into your practice. Can you share a little bit about that with us?
I'm glad you brought that up. Actually, with osteoporosis, there is a medical supplement that we have that can help people who have thinning of the bones. But in general, people who have arthritis are looking for supplements that can help them rather than medications that maybe they can't take or they've had troubles with. There are a multitude of medications that are out there. There are also a multitude of supplements, and people get very confused. And in our practice, we like to take a holistic approach to the patient, and that would include supplementing your diet, supplementing with herbs, or with what's called a medical food, which is a prescription-based medication now that doctor does need to prescribe for you.
Why don't you tell us a little bit more about that, because that's something that's really on the horizon, and it's a very exciting field.
It is, it is. There is one that's out there that's called Limbrel, and Limbrel is a medication, medical food, that is used to help treat arthritis. And it is well tolerated in patients, especially those who are on blood thinners and people who can't tolerate oral medicines. It's wonderful for a lot of our elderly patients as well. And that's just one of the simple things that we're doing to augment people who have chronic arthritis and pain.
So let's talk about the patient that's watching, the person who's watching, because they're not really a patient until they decide to take some proactive action to come see you or see someone else. So now they're going, well, I think I'll go to a health food store. Oh, gee, there's a homeopathic place down the street. Well, let's talk to those folks and tell them really what they need to know. When should they make the decision to call you instead of trying to do something like that on their own? At what level should you say, you know what, that's not going to do it, come see a real doctor?
Actually, I'm glad you brought that up as well, because any patient that comes into the office, I encourage them to bring their supplements. Bring the bottle in, because you can't read half of what is in the bottle anyway, and we can tell them if that is appropriate for them or not. There are so many additives that are put into these that are not necessary, and maybe we can hone down those vitamins and supplements to one or two that would make life a whole lot easier for them.
So it sounds like you've got a practice really where you have people come in and you say, hi patient, I want to know all about you. I want to take a whole look at you and what you do. Oh, you don't like this, you do like this. Let's try and find some, let's call them cures, but they may not be complete cures, but let's find things that advance their or reduce their symptoms so that they can have a better quality of life. That seems to me the life that you live in your office. Does that sound about right?
Absolutely, especially the patient who comes in and says, I hurt all over. And then we have to piece it apart and decide why they hurt all over. And we have an adjunctive approach to adding many different medications, a holistic approach to that chronic total body pain.